Hello and welcome to this special edition of Catholic Current. From Washington, D.C., I'm Maura Moser. As the nation marks its 250th year, we are discussing and celebrating the Catholic commitment to healthcare in the United States. Women religious played an especially important role in building the healthcare system in this country. That's why we are happy to have in studio with us today Sister Mary Haddad, President and CEO of the Catholic Health Association, and Brian Reardon, Vice President of Communications and Marketing. Welcome, Sister Mary and Brian. Thank you for joining us.
Thank you, Maura. It's a pleasure to be here with you.
So we are celebrating the 250th anniversary of the signing of the Declaration of Independence. But Catholic sisters who established some of our earliest hospitals were here even before 1776.
That's right.
Can you share with us how Catholic sisters were part of the fabric of this nation from the very beginning?
Absolutely. It's a great story to tell because the sisters actually came into this country in 1727. So you think about, how long they've been here and what incredible work they did in creating, I think, so much of the network and the foundation that we see today. And it was the French Ursuline sisters who came to what is now known as New Orleans, right? And what's interesting about when we look at the flow of the sisters who came from primarily Europe, they came to provide for needs of those settlers who were coming into various parts of what was now Louisiana. And so when they came with the intention to primarily care for the spiritual needs of the people who were here. But with that, they recognized that there were so many other types of needs that evolved. We had health needs, there were needs for education, a whole host of things. And the Ursuline sisters started Ursuline Academy. And I was stationed in New Orleans probably back in the mid-'80s, and Ursuline Academy is still present there today. And it's remarkable that within, I think it was 3 years, they started the first hospital. And think about today, right? It takes about 7 years to get a strategic plan off the ground. So they were doing remarkable work. But I think what is most notable, they didn't come with a particular plan. They came to respond to the needs of the day. And I know for the Sisters of Mercy, my order and most orders have within their constitutions that the sisters always respond to the needs of the time. So that's indicative of what we see in the foundation.
And you think of it, the Catholic Church as being a missionary church, and the United States at its formation, really, we were the country that missionaries were coming to from Europe. They were called, in many cases, by bishops who would write to orders in Europe to say, listen, we've got French immigrants in the New Orleans area. We need people who speak the language. We need care for that. So it was really a response. It was being called, in many cases, by bishops and priests here that had settled in the United States and called people over. So the missionary church was really alive and well at the beginning of this country. And it just, again, we think of, the work we do today in sending folks around the world, but really Catholic healthcare started as a missionary outreach of the church in Europe.
And you see that even today. And as I said, I lived in New Orleans, and the area where I was in the Irish Channel, there were 4 different churches. You had an Irish church, you had the German church, the Italian church, and the French church. It's because those folks came over to care for that particular population, and the church evolved in that same mindset, which is fascinating to see the culture that continues to exist.
What did healthcare look like back in those early days of the Republic?
Well, let's think about what the environment was like at the time, right? Pretty rustic and pretty dangerous, So I'm sure that they weren't worried about knee replacements and, heart issues as much as they were worried about gunshot wounds and, other things. But in all sincerity, they had to deal with so many natural disasters as well. And, epidemics and a whole host of things. So they were constantly responding to the needs that were evolving. And we see that the sisters served throughout the wars, in the Civil War, Spanish-American War. And we recognize the fact that the sisters had to convert the schools into makeshift hospitals in order to provide for those needs. So it was very rudimentary. We had sisters on the hospital ships, on the battlefield, everywhere to provide care. So what's also interesting when we think about this, that healthcare was delivered in the home. There were no hospitals at the time, right? So people who had places to live certainly got care in their home. But we think about, those who were without adequate housing. And so we see the evolution of these institutions that were created who could care for people without those particular services. And so the sisters were known for good quality care. And as they created these institutions, these hospitals as we know it today, more people recognized that's where they wanted to go for care. So we started to see a shift. And as we know today, if you have means and you have health insurance and you have access, you go to the hospital. If you don't, you're without. So it's a flip on what it used to be in this country, which I think is an interesting turn of events. But I would say in the early foundation, it was pretty rustic and pretty rudimentary. But
well, the home health thing I think is interesting too, because in today's policy discussions, there's a lot of talk about hospital at home. There's talk about how do you bring care to the patient as opposed to the patient coming, and that's really the founding of healthcare, particularly by Catholic sisters going door to door. Like you said, they didn't come over here to say we're going to build a hospital in Baltimore. They ended up doing that, and in a lot of communities. But that was based on the fact that people who are not Catholic in the communities often saw these sisters ministering, particularly to women and children, immigrant families that had no other source of access to care. And, business leaders and communities are like, they're providing better care than I'm getting. Yeah. And conversations started, fundraising started, and that's where we saw hospitals being built. They never really came over here to say, we're going to build a 100-bed hospital. Really, it was to come over and care for people in the homes, and that evolved. And again, it's interesting today to see that we're kind of, in many cases, trying to move back to that, to providing that care in the home. So it's interesting how things kind of come full circle, but our sisters really were committed to providing the right care at the right place and making sure people had access to care that otherwise would not have.
Yeah, and I want to pick up, you mentioned about how Catholic sisters served the wounded in the wars, and very often they may have been caring for people who were not Catholic themselves. And even today, Catholic healthcare serves populations that may not be predominantly Catholic.
That's right.
But working in these kind of underserved areas, how did they relate to the surrounding culture? Did they face hostility? Were they welcome in these spaces?
I'm sure they were run out of Dodge by shotgun, but going back to the war, recognize the fact that they were caring for both Union and Confederate soldiers. So there was no discrimination. They cared for those in need. And I think because of that consistent, compassionate response to those who had needs, there was trust evolved. And in fact, there are stories written and records show that they were known as the angels of the battlefield. That people, they wanted the sisters by their side at time of death. And so they began to really, I think, set a foundation for what Catholic healthcare is known for in this country today. People trust those who serve in Catholic healthcare, and it's a big part of it. But there was a lot of discrimination against sisters, and it recognized the fact that, it was anti-Catholic sentiment at the time. So they went through periods where they weren't wanted. And we were often places where there were very few Catholics, and the population there were not accustomed to sisters in this attire, and why they don't have families, and why are they not married, and who are these people? Yeah, right. So, I think they won them over through the consistent, compassionate care and indiscriminate care, and caring for all people, I think, was most significant.
The other extraordinary thing is you think of these sisters that came over sometimes, in groups of 20, sometimes fewer numbers. They didn't know any English. They came over to this land, and they had to literally sit in classrooms with kids that were 6 or 7 and learn the English language. Right. So what they overcame to provide care is it's just amazing stories of resilience and determination. And I think that, leading by example, they again, people in the community stood up and took notice
Yes.
that these remarkable women, in most cases, and again, there were religious men also that came over. I don't want to discount that, but primarily it was women religious who came over and again had to learn a second language, had to assimilate with the culture, like you said, in the midst of a lot of anti-Catholic sentiment. And to overcome that is just incredible, really remarkable.
You know, Mara, one story that I love to tell, and one of our sisters, older sister, who's no longer with us, had shared this with me. And Arkansas is where we had hospitals, part of the system, probably at that time 3% Catholic. And she said she was told that there were two gentlemen had gone into the local cafe and were talking about the hospital. St. Edward's is going to build a new wing. And he said, John, are you going to contribute to this? And he looked at him and he said, I wouldn't give those Catholics a red cent. He said, but I'd give the sisters the shirt off my back. And so it really does indicate how the sisters were so well received in those communities.
Wow, what a testament to their good work. I want to talk a little bit about kind of the role of the Catholic sisters, the women religious, and the bishops of the United States. They play very different roles in the church, of course. How did the sisters relate to the bishops kind of historically? I imagine there must have been tensions. And how did they prove fruitful at times?
Well, as Brian said, it was often a bishop who invited a congregation to come into their diocese. So we assumed that it was desirable to have the sisters come, but we can only imagine strong individuals trying to, live out their vocation and their mission. There's going to be tension. And I think the other thing that may have added to that, you have to think about these religious orders, their superiors were, in another country. So they weren't taking, their guidance and direction solely from the local ordinary or the bishop. They had the Mother Superior back in France or in Ireland or wherever it was where, they were accountable to that individual. So I'm sure they had to work this out. And I think with anything that bottom line, they were both committed to the same mission and vision of caring for people. And, in the name of Jesus, right? It was a faith-based, that actually impelled them to do that care. And I'm sure that there were times where sisters had to pack up and leave because they couldn't get along with the local clergy and, went elsewhere. And but in other places, it was really, I think, a testament to the commitment to those individuals and what they shared in caring for people.
Well, and I'm guessing a lot of your viewers have watched the movie Cabrini. Yeah. And there are some just wonderful scenes of the dynamic between the bishop, the Cardinal of New York, and Mother Cabrini. And I don't know how common that was. I don't know how historically accurate. But again, I think these women who came over, they had sort of their direction, what they wanted to do. And they were all about caring, particularly for those who were poor and vulnerable. So in a lot of cases, as I mentioned, they were very strong-willed, and they had in their mind what they needed to do. And so I'm sure there were times where there probably was some friction that arose, but like you said, it was all in the name of serving people of God.
That's right. And back to that movie, which was great, by the way, it also showed the tension not only with the church, but also with government. She took on the mayor. She wasn't going to let go trying to do what needed to be done for these children.
And speaking of government, I think we should mention more, kind of going back to some of your previous questions, the sisters and their involvement with President Thomas Jefferson. We mentioned the Ursuline sisters. And sort of the concept of religious freedom, they petitioned once the Louisiana Purchase came about. They were like, what's our status? So they wrote directly to the President Jefferson. He wrote back and said, no, basically, you're a tax-exempt entity. I don't think they put it in those terms back then. And then we mentioned the Civil War, and there's a couple of cool stories from that. One, President Lincoln's comments, you mentioned that about, the angels of healing or angels of mercy. And so he, had a proclamation on that. The other cool story that I love hearing about is Mary Todd Lincoln in the final days of her life. She was cared for by Franciscan sisters. And kind of the funny story, again, it speaks to their determination and just overcoming obstacles. Apparently Mary Todd had a very large, kind of ferocious dog, and this sister was just scared to death of the dog, but she overcame that, again, to provide care at the bedside for Mary Todd Lincoln. And those are like one of many stories of these sisters just really just showing an incredible amount of courage and doing, again, what they felt was right in their calling to serve others.
And when you think about what they had to overcome in terms of the territory, and, not only did they have to, take a ship over across the Atlantic, then to get on a train or go
Right.
by horseback or buggy to these places and thinking, I'm pretty committed, but I'm not sure if I'd be able to. I came at the right time.
The Providence sister, Mother...
Joseph.
Yeah, thank you. There's a story about her in a stagecoach. I think it was her that the stagecoach gets pulled over and the robbers are like taking money from everybody, and they see Mother Joseph and like, no, you're good. You hold on to your purse. So, I mean, there's just so many stories of the history of them and just how much respect that they earned through the years.
Yeah.
And that, of course, led to the incredible Catholic healthcare system that we have today that serves so many Americans. Now, there may be an impression that healthcare is healthcare, that there's no difference between getting your healthcare from the Catholic hospitals and the Catholic healthcare system or any other. Would you talk a little bit about what is the difference? How is Catholic healthcare different?
Yeah, I always like to tease and say there's no such thing as a Catholic knee replacement, right? So a knee replacement is a knee replacement, but it's, I think fundamentally we start by saying that we are impelled to do this work because of what we believe. So this ministry is directly connected to the belief in the person of Jesus Christ. And unlike other not-for-profits who do good service, it's unique. We're not just doing service, we're doing this because what we believe about people, we believe in the dignity of the person, we believe in common good, that we will care for all. Those are the fundamental elements of Catholic social teaching that are the backbone, I think, and the foundation of what we created, not only in healthcare, but in education, social services, all the various institutions that the Catholic Church provides care for people in this country. So I think fundamentally that's the difference. And it's how we provide it. It's the services that we do as we address what we call whole person care. We just don't look at your physical ailment. We look at your social support system that's necessary, that going back to the early foundation, the sisters recognized it wasn't just the illness, it was the social conditions that impacted their health that needed to be addressed. Healthy food, shelter, a whole host of things. And so we've continued, right now the buzzword is, right, social determinants of health. And I always say, we've been doing this, it's in our DNA. That's why we started, and this has evolved. So I think it's unique in that we provide for that, as well as the spiritual care for patients who come. We recognize that we get people at the most vulnerable time in their lives. And so we help them and help their families to be able to, really hold on to the hope of what, our belief gives us and provides us. So that's some of the, I can get pretty passionate about this. There is a difference. There is a difference.
And I think historically, too, the innovation that, again, Catholic sisters have provided and really spurred things to happen in the development of healthcare in the United States. If you look at hygiene, there was such a focus among the sisters of making sure patients were kept clean, that they're dressed, and that wasn't common medical practice. I mean, there was sort of a way of doing it, and I think a lot of the work that the sisters did in that were adopted by the Mayos of the world. I mean, the Mayo clinic was really started between a group of physicians and Franciscan sisters, because the physicians saw the value of what they were bringing in the nursing profession. I think you look at like schools of anesthesiology, nursing schools, really another fun story is about sisters in Wisconsin who cared for lumberjacks. And they would sell them a $10 a year coverage plan that basically said they got any treatment if they fell or whatever. They weren't covered if they got into a fight or they got drunk, which I thought was funny. That was like an insurance thing. But that was a that was a precursor of today's insurance program that was done back in the late 1800s. And I think you look at some of the innovations that have been done throughout the decades, it's pretty amazing that, again, I think that it really set the tone for healthcare in the United States.
And back to Catholic social teaching, using that example about health insurance, that the whole notion of pooling resources in order to care for a greater number of people. That's the premise behind health insurance. And today what we see with commercial payers, it's not going for the greater good, it's going back to bottom line. So, I think that the sisters did a beautiful job of embodying and living out our belief in, Catholic social teaching.
And another, just to follow up on your question about distinction, I think that, you touched on this, the whole person care and the spiritual component of care and how much emphasis we put on that and how important, and research has borne that out, that there's been literature reviews, by non-Catholic scholars that have said, providing spiritual care actually improves health outcomes. So this isn't just something nice that we do because it's guided by our faith. It's also something, again, that we understand as being part of the healing process, that it's not just the physical ailment. You have to support the patient's emotional needs, the family's needs, but also have to cater and really pay attention to their spiritual needs, because that's so important. And I think that is something, again, that distinguishes Catholic healthcare. And again, there's other religious, healthcare providers. But I think it's interesting to see the sort of science behind that being like, there's a lot to that.
That's right. And Maura, back to your point about the relationship between clergy and sisters, as Brian talked about the spiritual need, that bringing priests in as chaplains, they recognized the importance of that in the very early history. That was part of the structure of healthcare delivery for hospitals, that you had priests there providing for the spiritual care, sacraments, a whole host of things. So recognition that it was a collaboration with clergy and sisters in being able to provide that care.
Who is one of your favorite characters in the story of Catholic sisters and American healthcare?
I think this is a hard one to answer because there's so many, right? Brian was talking about, the issues with the gunfighter coming out or trying to.
The stagecoach.
Yeah, I thought you were going to go to. It was that sister that befriended Billy the Kid, right? So there's that part of that history. There's a book actually written about this. I think I could name several, and what I love about them is what we see integral to our healthcare system today. You mentioned, the Franciscan sisters and the relationship with the Mayo brothers, and think about the partnership that they did in bringing about, the Mayo Clinic today, and that's worldwide, it's known. They understood that they couldn't do this alone. And how do we work with others?
Collaboration, yeah.
Partnerships, collaboration. Sister Ignatius Gavin, really worked with Bob Smith, I think was his name, started AA, Alcoholics Anonymous. And there was a period of time when alcoholics came into the hospital, they wouldn't be served. I shouldn't say served, meaning drink.
Cared for.
They wouldn't be cared for because they were, drinking. And she helped them recognize this is a medical need. This is an illness. And so the whole, evolution of AA started. Mother Cabrini, I love the woman, not only because, she was able to take on the world, but, she was fearless. The courage she had in breaking through those barriers and providing. And I want to say one other person, and it's because I more familiar and have met her in St. Louis. She has now passed, but Sister Antona Ebo. And if you think about during the civil rights, she was, I know we're not talking about, healthcare per se when I talk about the civil rights, but it's about how we care for all.
It's all connected.
Absolutely. And she went down to Selma. She was one of the three sisters who went and accompanied others down to Selma to march. And you think of a Black woman, a Black sister doing that, and the courage it took for her to do that. But she gave witness. And she went on, certainly, she was the first African-American sister to become a CEO of a hospital. Remarkable women that we've seen throughout the history.
Well, and again, without naming names, just the legacy of the sisters fighting for racial justice. Yeah. And again, we know that racism, what that does to a person's health care, and they were decades before the civil rights movement, fighting the Ku Klux Klan in Indiana during the race riots in Springfield, Illinois in 1908, basically saying, I don't care what's going on outside the hospital. Inside the hospital, black and white patients are going to be side by side and they're going to be treated equally. So the courage and just the sort of pioneering attitude of being ahead of, on the right side of history, I think, again, speaks to the courage that these women have had over the decades.
I heard stories from our sisters during the time of segregation that they would actually, they would bring African-American patients in through the convent. The convent was connected to the hospital. And they would do it in the dark of night in order to get them in to provide care. And they'd talk to a physician who would do the surgery at night so they wouldn't be caught. So the sisters were breaking down barriers literally and figuratively in order to provide, for those who were being discriminated against.
Incredible bravery and witness.
Yeah.
Well, Sister Mary, Brian, thank you both for being here. Is there anything you would like to say, anything we haven't touched upon that you'd like to mention before we close out?
Well, I just want to thank you, first of all, for even bringing this to light, because it is a remarkable story. And we were chatting a little bit before we came in here. Back in 2010, the Leadership Conference of Women Religious did an exhibit that traveled across the country called Women in Spirit. And if those, hopefully some of your viewers had an opportunity to participate and experience that. But, even as a sister, for me to go through, it is remarkable to see the impact that sisters have had on this country in, healthcare, education, social services. It's just a remarkable testament to their courage, determination, and their faith.
Absolutely is. And I think, just to go back to a quick point you made earlier about kind of this being mission territory, and it still is. 60% of the dioceses in the United States are still considered mission dioceses. So we need that same courage and commitment today, that same missionary discipleship.
Yeah.
So anything you'd like to add, Brian?
No, I think that, again, the work continues. You can pick up a news account on any given day. And I know just this past week, there was a 90-year-old sister in East St. Louis that, again, is still the sisters never retire, right? That's one thing I learned early. I've been in Catholic healthcare for over 20 years and learned very early on that, no, they don't retire. They just move on to different roles. And the contributions that the religious sisters, and again, I know there's, religious men that are also involved in healthcare and they do great work, but really the foundation of Catholic healthcare in this country really has been led by these amazing, and I don't use that word lightly, just amazing, incredible women that just have a character, and I don't know how they do it. The energy and the commitment and the dedication and the love of what they do is really just awe-inspiring.
Amen. Thank you, Brian, Sister Mary.
Thank you.
Appreciate you being here with us.
Thank you.
It's great to be here.
And thank you for joining us for this special edition of Catholic Current. You can find out more about our ongoing celebration of America at 250 by visiting us online at usccb.org or follow us on social media at usccb. I'm Mara Moser. See you next time.